And we're live, dude. I was before. What's going on, man?
Long time no talk.
Yeah. Right. A little phone call, but dude, man. So I finally got you on the podcast. Thanks for coming on. Thanks so much.
Yeah,
Um,
thanks for having me, man. I'm
yeah, yeah.
excited.
Let's hop right into it. What's So where are you at right now? Residency program. So tell me what's going on.
Yeah, so for those of you listening, I'm Syed Asghar. I'm a PGY-6 over at LSU New Orleans. I'm just finishing up residency here. Excited for the next step.
So 6 years in. How's that journey been for you, residency and all?
Oh, it's been great. This program is what I knew I wanted to go into when I was applying. Super busy, tons of surgery, a lot of autonomy. So it's been good. To your question, I think probably this is relatable for most residents, kind of reflecting on the journey for the last couple of years quite a bit. And overall, it's been a very positive experience. Yeah.
Yeah, man, a lot of surgery. Let's go into one of your recent projects, Surgeons Lounge. Huh?
Mm-hmm.
That's a big part of why I wanted you to come on, and let's talk about that. From your perspective, your like side of it, what is it? Let's just talk about surgeonslounge.com. What is it, for example?
Yeah. Surgeonslounge.com is a website that I created here at LSU during residency to serve as a tool, a practical tool for residents and full-fledged oral maxillofacial surgeons to use on the fly and use as a reference, both for how to do surgery and everything related to perioperative management, patient management, classifications, billing and coding, documentation, you name it. So, I guess in summary, the website is a comprehensive platform for a surgeon to have and use throughout their day-to-day clinical life.
Let me just give exactly. Let me just give a little background too. So Syed and I, we got in touch, I guess initially through LinkedIn. That was through
Yeah,
LinkedIn,
yeah,
right? We got in touch through there. So we were just kind of chatting. Next thing I know, that he's the founder, the sole initial founder and creator of Surgeons Lounge. And I was like, wait a minute, you're the creator, owner, founder, starter of this website that I've been using for several months now during residency. Because and for listeners, as you go through residency, you start as an intern. That's the first year resident, and as you go up and up, you get more into the OR, you get more into the big level procedures. And where do you kind of go to learn about these procedures before you do it? Well, you have textbooks, right? You can read, you could go to YouTube, you could go to the AO reference. And one of my co-residents suggested, look at this website, check it out, Surgeons Lounge, go through the sequence of photos from start to finish of this approach of the this mandible fracture repair, of the radial forearm fleet we were just talking about it before.
right.
And dude, I looked on this and I've been using it almost daily, every week at least, but sometimes some weeks daily, because the quantity of procedures and stuff. Outstanding. I've been using this almost on a daily basis now for the last few months, and I'm so thankful for finding this. And dude, now that we got in connect, so I would describe it as a website. It's kind of like AO reference, but reference gives a lot of diagrams, a
A
lot
lot of
of
textbook
intro.
information.
Yes, a lot of textbook information, and kind of puts it into basis of the surgery itself. Surgeon's Lounge is the surgery. It's photos of every step through the surgery. So now you already read the textbook, you already did this, but now it's a quick review, maybe the morning before the case, the week of the case. And now you get some actualized information and examples of what you're about to do in 15 minutes. So would you agree with that, Syed?
Yeah, absolutely. I think a lot of what we learn in surgery is anecdotal. It depends on our mentor. It depends on who your chief is in the case, um, and there isn't really a standardized practical base of information for you to plan or perform your surgeries based on. And so one of the things I struggled with, which I'm sure you have and most of our residents do, is that there's nowhere with consolidated practical information on how to do a case or how to perform, or things to think about for the consent, or how do you code this procedure, how do you bill for it, and what do you tell the patient for post-op. You know, Typically what you do is you just ask your senior, or you look it up on XYZ website. But a lot of the genesis of this site was just to consolidate all that information, so you wouldn't have to do Googling. You wouldn't have to go to the AHA website to figure out prophylaxis guidelines. You wouldn't have to, jump through all those hoops to find something that should be pretty easy to find, based on a specialty that's as big as ours.
That's it. And there's a lot there. I mean, in dental school, especially, you look at oral surgery and you're like, I like to take out teeth. Implants look pretty cool. Orthognathics, awesome. And then you get into it and it's like, there's so much more to learn. It's never ending learning. And where do you really go for that learning? Now we have more resources, and Surgeons Lounge, I mean, is at the forefront of my list of go-to.
Yeah, that's great. And, I think that kind of speaks to a testament for that need, because when you and I had first started communicating, it hadn't even really been advertised anywhere yet. Certainly, it's still not really on social media or anywhere. And I think the fact that it has spread through word of mouth, and somebody as far away as New York has been using it, or we had some applicants to interview here recently, people from Buffalo, people from the West Coast, and some of those applicants had already heard of it too. So, I think the need is there, and Surgeons Launch can hopefully provide that value.
It does. It does. I mean, it's spreading like wildfire. And to hear of the other residents and students already checking it out, using it, it's a testament to everything you've done in this work. And let's go into the forum, like the threads and discussion board, kind of like a student doctor network into it. Tell me a little more about that.
Yeah, where do we go to communicate as a specialty, as residents, as applicants? As of right now, there's pretty much just the student doctor network, or you call up somebody who's in residency who's done it already, and you get a little information, or you talk to staff and you get a little information. And so that was something I struggled with. I remember at the end of my application cycle, I got my match letter, and I called up one of my mentors, a guy named Joey Chang over at Tufts, and I was like, thank you, because you are one of the few people that has provided me with genuine information on how to overcome all these obstacles. And it's just tough. It's tough for applicants. It's tough for residents. It's tough for even practicing surgeons to get up-to-date information on how to do things, or why we're doing things, or what the newest guidelines are, or what people are doing in Germany or India, or and so a dedicated forum for OMS, I think there's like a world of potential there. And so that was a key component of the site that I added on recently, actually within the last week. And it's broken down by different categories. There's like a residence corner, there's an applicant's corner, there's a place where you can discuss your challenging cases. It has to be done in a HIPAA compliant fashion, obviously, because it's a public forum. There's this forum in category for a fellowship application, for insurance and billing, for buying and selling things related to OMS. So anything that I could think of that would be a practical solution to an existing problem, I'm trying to address with both the website and the forum. So
Yeah. Oh, yeah. And I think as this builds, there's also opportunity in different avenues as far as platforms, channels, to really get in front of more eyes, get the awareness out there. You started the Instagram page, right? We'll get that up and going over the months to years ahead. It's only upwards from here. Like, this is outstanding. Something you touched on were the challenges for dental students, residents. You were just mentioning about, like, what about fellowships, the applications there, even attendings to getting insights on certain procedures, right? What about for you, this challenge, this obstacle that you've gotten over? You're an oral surgery resident. You're not running around willy-nilly on weekends with all the time in the world. How did you find the time, motivation, the time, and to keep a good attitude about making this during your residency? You created a website, other people want to hear about how you were able to do this, because, some people have ideas too,
Yeah, man, it's been tough. It's been around 2 years in the making at this point. I initially had started it on a pretty limited website platform, and I kind of realized early on that I needed to do it on a platform that could provide scalability. And so initially the website was pretty good up until about November. And I put a lot of work into it, a lot of manual uploads and doing every single art. There's a lot of technical stuff that goes into it. And finally, I realized, I had to kind of keep believing in the vision for it. And so I transitioned over to another platform that's a lot more technical and a lot more difficult for like a layperson like me to use. But over a couple months, I was able to figure it out, luckily. And now it's on a very, very robust platform where we can scale, infinitely. And I think set it up in a way where this is only the beginning. So yeah, there's a lot of time. I'd get out of the OR at 5, 6 p.m. and I'd take a little refresher, and then from like 7 p.m. to like midnight or 1 a.m. work on the site, probably for a good 6 months straight.
That is dedication. I don't think even dental students, it's tough. Dental school's tough. But residency, getting out of a 12-hour day, for example, getting out of the OR where you've been on your feet for 10 hours plus, going home, taking a shower, getting a bite to eat, dude, and then now you're on the laptop in front of the screen for another 4 or 5 hours, maybe more some days. The dedication and commitment to it, like, there's a lot of perseverance involved with that. So, and I know too, it's a lot, man. Do you have any backgrounds with websites, or how did you pick this up?
Yeah, you know better than I. I mean, you're slammed with work. We talk about your call responsibilities and all that, and then being able to do what you do. Hats off to you as well. But no technical experience, no coding experience, nothing. And so by and large, it was just kind of mess around with the software, see what happens, mess around, see what happens. So that was really the biggest hurdle for me, the content, the surgical aspects of it. That was a separate challenge in its own way. But yeah, thank God, I think we're in a good spot now.
Yeah. A great foundation, solid foundation, dude. And I mean, and we talked about this, some of the feedback that I've been able to give you through people that I've asked and talked to about it, the feedback you've been getting. I mean, there may or may not have been, right? We got to generalize, a program director seeing that this could potentially, given it needs some work, right? It could potentially have some formulation of a curriculum even for oral surgery residents, right? Let's standardize some approaches, some, background to surgery and whatnot. There's so much potential here. And, where it's at already now is so helpful and insightful. Sky's the limit, man.
Well, that's good to hear. Like we were talking about, for me, it's great that people up in New York are using it, at a program like yours. It's extremely strong. You guys do a ton of trauma. You do a ton of everything. So, the fact that that is happening right now tells me that, it could continue. And there's a lot of needs for it to continue besides, just surgery. Like you said, education, resident, resources of all kinds. So
yeah, and and in some aspects, we're trying to be like your program. We're wannabes your program, right?
Don't know, man. Everyone's got their thing.
Yeah. Are you? So you're in Scrub? Are you in the hospital right now? Where are you?
Yeah, I'm at my clinic. There's always stuff going on. I see you're in scrubs today too, on a Saturday morning, right?
Yeah. Actually, I had some sweat stains on the hospital scrub, so I switched to figs real quick. But anyway, I get those bad pit stains,
Yeah.
So actually, just touching on feedback before we move on to that next topic that we mentioned before, what's one of those questions, the feedback that you got on Student Doctor Network? I wanted to be mentioned because on this podcast, I'm going to put it up on YouTube, going to put it up on the podcast and whatnot. We're probably going to clip it, put it up into clips, put it on Instagram and such in the future. But specifically, you can mention that comment because I think this is really applicable for the viewers and listeners to kind of give their insight on and touch on it. You know what I mean?
Yeah. You're talking about like what specific feedback I was given so far?
Yeah, with keeping it just OMFS versus, maybe adding more approaches and different insights to other specialties and areas potentially.
Yeah. It's an interesting topic and something that I've been thinking about a lot recently. When I first started the website, I put up a couple articles on different procedures, step-by-step photos of how to do them. And one of the ones that really took off was the submental intubation article. And it turned out that most of the people using it were plastic surgeons and ENT doctors in our hospital system. And so the question for me after that was, is this going to be a platform just for OMS, or is this something that will be a broader platform for anybody that's doing head and neck surgery? And you and I have spoken about it. I'm still kind of dialing it in my own mind, and I think the answer is that it could apply to all of them. However, right now, the greatest need and the greatest high yield information I think we can give is to our own user base, which is oral and maxillofacial surgeons. So that is something potentially in the future I would consider, but right now I want to continue to target it towards OMS. And as no upcoming plans to change that. I think we have enough need in our specialty. We have such a broad scope. We have people doing craniofacial, head and neck, cosmetic, to the point where we already have everything that we need just for OMFs. So I don't
look into that. Yeah, I don't know what that. All right. Anyway, my next question I want to ask. So, people that go onto the website, do you have to have a membership fee? How do you log into it? Can you see cases just without a login? What's the current status of that? Do you have to pay for this? Is what I'm asking.
You do not. You do not have to pay for it. Everything is accessible without logging in. Also, right now, to get onto the forum, though, you need to log in. In the future, I think having a membership option is a possibility in terms of what content is provided to different users, but right now everything is available to anybody.
That's excellent. No, that's excellent because now it's accessible for all, whether you're a dental student, resident, attending. And yeah, like you said, the avenues that you can go with this, we'll see. That's really good. Awesome. So where'd you go to dental school? Let's hear about your background a little bit. I want to get myself. I mean, we already talked, I know, but viewers, listeners, let's get an idea where you came from. So obviously 6th year right now, LSU, OMFS.
Yeah.
What dental school did you go to?
Well, my educational story is a little different than most. So I'll tell you, I grew up in Virginia and I went to high school there. After that, I had a cousin who finished medical school in India, and he started his residency when he was like 22 in Chicago. And I was like, okay, this is interesting. So I checked it out, and 2 weeks later, I had a backpack on my back, and I was in India talking to different dental schools about how to get in. And so at 18, I ended up doing dental school over there. And it kind of worked out as a blessing for me because I wasn't like a superstar student or anything. I was just getting by really good. So I ended up there. It's like swim or drown, so I had to. So I kind of turned it around there. So I was in India for 5 years. 4 years of dental school and then a year of mandatory internship. And that was wild, as you can imagine. I mean, my parents are Indian, but I realized about 5 minutes off the plane that I was very much American. So yeah, it was intense, man. We had school for 6 days a week. A uniform, boys on one side of the class, girls on one side. The exam structure, the educational structure, everything's extremely different than what we know over here.
Why do they separate like that? And what are some differences? Just because I can't even imagine what to think.
It's just the old British system, I think. And they just keep it going. Differences, everything you could imagine. My school turns out that the land in the big cities there is very, very expensive. So most big institutions tend to be outside of the city, or a lot of them, at least in the area I was in. So the college I went to was 100 kilometers outside of the city of Hyderabad. It's like it's just a city of 8 million, dead center in India. And so it was a 2 or 3 hour bus ride out into this village, and there was a.
Did you just say 2 or 3 hours?
Yeah, it was
one way.
Pretty bad roads. And so, yeah, the school. There's a hospital. There's a dental school. And then the associated colleges with both of those. And so I would, we'd go on Monday, stay in the dorm. They called it the hostel over there. And then get done with school Saturday afternoon and go back to the city. That'd be normal for a little bit.
For a day?
Yeah, it was tough. No air conditioning. My final My final year, we only had 2 hours of water per day.
2 hours of water?
7 a.m. to 8 a.m. and then 7 p.m. to 8 p.m. So we would store it in our buckets just to be able to take a bath and stuff. Crazy. Like it
What would
feels
you drink all day?
just bottled water. That was different. But like
Okay,
bathing,
so you could get bottled water,
yeah, yeah,
but then to shower and so you had to store it in buckets from 7 to 8 a.m.?
yeah. Crazy, right?
I can't even imagine this. No, this is eye opening for me. Yeah, this is unreal. And
Yeah,
then a 2 to 3 hour bus drive. So then you stayed there overnight. They separated boys and girls and stuff.
yeah,
Still,
yeah. There was like I said, they called it the hostel. So it's, you have a roommate, uh, the mess hall, the shared cafeteria.
oh
But it
man,
was tough. The school over there, they don't have multiple choice questions. Everything is written. So, for example, they would say, like, the question prompt would be facial artery. And so you write facial artery at the top, you underline it, you draw a diagram of it, you label all the branches, and then you break it down by section, like origin, area supplied, branches, and like a clinical application, something like that,
wow.
for every single question. So the exam papers would end up being like, you're handwriting like 10 or 15 papers worth of information before the exam is up. It was wild. So after I got there, before that, I'd kind of been able to just do nothing and coast. And suddenly I went from being that to being like the dumbest person in the room.
Stop.
And I really had to turn it up after that. But yeah, it was a wild experience, man. And after that, I did that mandatory intern year in the city, and the clinic there, the number of patients, the pathology, it's insane. Just as a dental student, between like 9 and 12 in the morning, I remember I would routinely with my friend see like do 40 patients. We'd do extractions on 40 patients
As a dental student,
as a dental student. Yeah,
on 40 patients just in the morning session.
nothing but a number 9 and an ash forceps. We had 3 different ash forceps. The anterior, they called it the premolar one, and then the molar ash. So it was wild. Yeah. And it was like an assembly line. So my friend or I would, like, we'd see like 10 patients at a time. One guy would go through with the local, boom, 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 boom. The next guy would come through with the elevators, boom, 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 boom.
Wait, one syringe, multiple
No,
patients?
no, no, no,
No.
different range. But
Okay, okay.
yeah, that being said, the sterilization, all that wasn't great either. But yeah, it's crazy if you think about it. And I mean, that's going on, in other parts of the world. So
Yeah. Wow, that's nuts. Tell me about how did you get back to the United States? Did you end up having to do any dental school here? Did you go right to residency? What does that process look like?
yeah, I was definitely naive going into it. Had the the goal was to like save time and money. Maybe I saved some money, but save zero time. If anything, I probably lost time because
You
the
think so?
the application pool to get back in here is like insane.
Yeah.
Right? I remember as I was interviewing at like UCLA or something, and they had, I think it was like 9,000 applicants for like 30 seats or something. Like the number was absurd.
Yeah.
And they're all dentists. They're all like qualified dentists from around the
Mm.
world. So it's kind of funny to think about it in hindsight, but I was struggling to get back into dental school, and I just wasn't getting interviews. And by that point, the NBDE, the National Board Dental Exam, was pass fail, so they didn't really have a good gauge on how to stratify applicants. So in the meantime, I had already known that I wanted to do OMS, and so I was just doing these like observerships around the country.
Mm.
And so I was over at Tufts for one, and just by some stroke of luck, one of their interns in OMS, he was a little too stressed out or something, so he quit. And I had already taken the CBSE in preparation for OMS, and so the program director at the time was like, what are you doing for the next couple months? And I was like, I'm applying to these 2-year advanced standing dental programs, having difficulty getting in. And he was like, well, we need an intern for the next 5 or 6 months. Why didn't you apply to Tufts dental program, because they start in July, and it was around October at the time. And I was like, I did, but I never heard back because I wasn't getting out, interviews from anybody. And so he's like, all right, well, send your application in. We'll see if we can make something work. And I did. Actually, I ended up going upstairs. I knocked on the dean's door, and he was like, I like you. I like where your head's at. Blah blah. Next thing you know, the next day, I got into the OMS program as an intern, and then that concluded, and then I started the 2-year dental program after that. So I did it backwards.
That's unreal. Wait, so you right the 2-year for I guess international dentist. That's the 2-year dental.
DMD
so you
program.
did like the intern 6 months.
Yeah.
2 years of dental school, back to oral surgery or you just did the intern year 6 months, 2 years, and then to LSU, or did you do anything back at Tufts?
That's it. Yeah.
Wow.
Yeah.
Wow.
So it's like this crazy convoluted path. I mean, it ended up working out, but even when I was applying to residency programs at the end of that advanced standing, I knew that I wanted to do a 6-year, but it turned out that those 6 years were not interested in interviewing me because my undergrad was not from America. Even though I had, I had the CBSE score and all the things, I had you name it. So there were some that even gave me interviews, then rescinded them. There's a lot of places I interviewed that during the interview day were like, oh, where's your undergrad from? And then, I could tell that they were like all of a sudden like, oh, I don't know if we can entertain this guy. That was a challenge. And part of me knew that was going to happen. And so I was like heavily brainstorming ways to make myself more appealing as an applicant because, as you know, it's super tough getting in anywhere, right?
Yeah, yeah.
So during those 2 years, right, it's kind of a repeat of dental school, so you kind of know most things already. But I invented a surgical retractor, and that was my thing for interviews. Like I brought it with me, I showed everybody. And
wait, really?
Yeah.
That's awesome. Do you have it nearby? You probably don't have it nearby.
No, I don't have it. I used it a little bit a couple years ago, but I haven't really used it since. But yeah, it's named after me. It's called the Asghar retractor. So I brought that here to LSU, and they got a huge kick out of it. They thought it was hilarious, but it worked out.
That's awesome. I wish I could see it. That would have been great.
Yeah, I don't have it with me, but I could probably. I have a picture here on my phone. I could probably pull. I don't know if.
Hey, yeah, pull it up. Pull it up. Let's see this thing, and then for part 2, we'll do a part 2 podcast at some point, and bring it up. Maybe we'll even start the Surgeons Lounge podcast. I know we talked about some ideas. There's a lot of good avenues that we could do about this.
So here it is.
That's a little blurry on my end. Wait, hold on.
Is it?
What's on is that your left or right side? The something retractor?
So there's the conventional and then the Asghar, which is my last name.
Yeah, I got. It says conventional. It's just really blurry.
Yeah, the concept is like, when you're taking out thirds, that distal tissue tends to kind of get in the way. And so a lot of times you end up having your assistant retract posteriorly, especially so that you can figure out, how far you are from the lingual plate if you have to remove distal bone, so that you don't accidentally go through and cause a lingual nerve injury.
Right.
This was that you could retract both simultaneously. It's kind of like a Minnesota with the distal flange on it.
I see what you mean. Okay, I see it now. Yeah. It got clear.
So that was my little claim to fame, but it worked out. I got into LSU, so I was happy.
That's awesome. Yeah. What a story, dude. I think your story of start to finish on your path, I've never heard this before. Like, dude, your story is wild. Has anyone told you that? It's
wild for sure. I probably should have just studied hard and been normal like you, and that would have made my life a lot easier. But
my story sucks compared to yours, man.
No, for like the overall life perspective, I think it was good. Living in the third world is like it changes your viewpoint.
Yeah, and so you grew up in like younger in Virginia, you said, right? Were you born in Virginia?
No, I was born in Boston, but I went to high school in a place called Lynchburg. It's like an hour south of Charlottesville. Like beautiful,
Gotcha.
It's a good spot, but kind of a world away from that, and a world away from where you and I are now. So
Yeah, the world and our perspective of it changes over time, right? Things get harder, things get better. Speaking of that, what are your next steps? Where are you going next? You going to stay in the LSU area? You going to go back to Virginia, maybe Boston, maybe?
no, I'm going to be. My family has since kind of all moved over to Houston, so that's the plan for next year. Private practice over there.
And so you're in your last month, almost technically second to last month of residency, because you said June 28th, right?
Yeah. Last
Why do
week.
they hold you back so long? So at our program, June 2nd, 3rd, it's like, okay, come by for another week if you want. Like, why so late? Tell me a little more about that without like,
Okay, we'll have to take that up with my chairman. But it would have been nice to maybe get a couple more weeks. But whatever. It is what it is.
that's all good. That's all good. Yeah. So you're thinking Houston because of family,
Yeah. Yeah. It's a good spot.
private practice.
Yeah.
You
Yeah.
signed already? You're ready to go? You good to go?
Things are in the works right now. I know it's pretty late, but I think it'll work out. But as you know, like residency ends up being so demanding, right? For your time, for your headspace, your bandwidth to think about other things. That one of the things I'm looking forward to the most is just being able to spend time with people again and like engage with my family like I used to. So I'm looking forward to that. Yeah.